Hi, this video is to tell you about the statistics of a brain aneurysm. The reason it is not in the other videos is because we did not find this information until after those videos were made. We also could not find the Canadian statistics, so we had to use the United States. An estimated 6 million people in the United States have an unruptured brain aneurysm, or 1 in 50 people. The annual rate of a rupture is approximately 8 to 10 per 100,000 people, or about 25,000 to 27,000 people in the United States suffer from a brain aneurysm rupture. There is a brain aneurysm rupturing every 18 minutes. Ruptured brain aneurysms are fatal in about 40% of cases. Of those who survive, about 66% suffer from some permanent neurological damage. Approximately 15% of patients with an aneurysm, subcarotenoid hemorrhage, or in other words, SAH, die before reaching the hospital. Most of the deaths from SAH are due to rapid and massive brain injury from the initial bleeding, which is not correctable by medical and surgical interventions. 4 out of 7 people who recover from a ruptured brain aneurysm will have disabilities. Brain aneurysms are most prevalent in people aged 35 to 60, but can occur in children as well. Brain aneurysms can cause a hemorrhagic stroke, which is a stroke caused by a ruptured blood vessel and characterized by bleeding within or surrounding the brain. A subarachnoid hemorrhage from a ruptured cerebral aneurysm can lead to a hemorrhagic stroke, which occurs in 50-year-olds that are typically no warning signs. Most aneurysms develop after the age of 40. Most aneurysms are small, about 1/8 of an inch to nearly 1 inch, and an estimated 50 to 80% of all aneurysms do not rupture during the course of a person's lifetime. Aneurysms that are larger than 1 inch are referred to as giant aneurysms and can pose a particularly high risk and can be very difficult to treat. Women, more than men, suffer from brain aneurysms at a ratio of 3 to 2. Ruptured brain aneurysms account for 3 to 5% of all new strokes. SAH is one of the most feared because of the acute headache upon presentation to the emergency department. Headache accounts for 1 to 2% of the emergency room visits and up to 4% of visits to the primary care offices. Among all patients who present the emergency room with headaches, approximately 1% has subarachnoid hemorrhage. One study put the figure at 4%. Accurate early diagnosis is critical, as the initial hemorrhage may be fatal, may result in devastating neurological outcomes, or may produce minor symptoms. Despite widespread neuroimaging availability, misdiagnosis or delays in a diagnosis occur up to 25% of patients with SAH. When initially presenting the medical treatment, failure to do a scan results 73% of these misdiagnoses. This makes SAH a low-frequency, high-risk disease. There are almost 500,000 deaths worldwide each year caused by brain aneurysms, and half of the victims are younger than 50. Based on a 2004 study, they combined lost wages of survivors of brain aneurysms rupture and their caretaker for a year were $138 million. The cost of a brain aneurysm treated by clipping via opening brain surgery more than doubles in cost after the aneurysm has ruptured. The cost of a brain aneurysm treated by coiling, which is less invasive and is done through catheter. A catheter is a hollow flexible tube for insertion into a body cavity, duct, or vessel to allow the passage of fluids or to stent a passageway, used in the endovascular treatment of cerebral aneurysms, increases by about 75% after the aneurysm has ruptured. 10 to 15% of patients diagnosed with a brain aneurysm will harbor more than one aneurysm. Those are the statistics for a brain aneurysm, and I hope you learned something. Bye.